Spokesperson Caroline Jones.
Cabinet Secretary, the overspending by the local health boards can be equated to the large amount spent on agency nursing. Last year, the Welsh NHS was spending £2.5 million each week on agency staff, which will undoubtedly be cut back next year. However, we simply don't have the permanent staff available to make up the shortfall, so it will be patient care that suffers. Cabinet Secretary, how will your government ensure that local health boards are sufficiently funded to provide safe staffing levels in the coming financial year?
We fully expect every NHS service to have safe staffing levels. I recognise what you say about agency costs. It isn't just nursing agency costs. There are agency and locum costs across our system that are part of the very real financial challenge that we face in delivering and sustaining models of care. And there's an honest conversation to be had about whether we are sustaining models of care that are right and are appropriate, or whether we're actually spending money in a way that isn't very efficient or appropriate. So that's a conversation that each of us will need to engage in. But of course, in the field of nursing, we're extending nursing levels with the implementation of the Nursing Levels Act. So I expect to see more nurses recruited to Wales on a permanent basis. But following the first question that's been asked, you'll recognise that there is a challenge to that with the reality of how European Union-based staff feel about coming into the UK. There are figures that are publicly available on the numbers of nurses that either left the UK or are no longer considering coming here. In particular, in England, the source of recruitment from the European Union has dried up significantly, and that is a real challenge for us in sustaining our services and what that does mean in terms of actually having to pay an even higher cost to get staff into our health service to provide the care that all of us would expect to be delivered.
Thank you, Cabinet Secretary. The Assembly passed the Nurse Staffing Levels Act last year with the promise that this new legislation would deliver safeguards for patient safety and put an end to situations where nurses find they have insufficient time to properly care for patients. Your government is currently consulting on the statutory guidance, which leaves out any mention of the recommended nurse-to-patient ratios and any mention of the supernumerary status of ward sisters. Cabinet Secretary, do you agree with me that this consultation sends out the wrong message about safe staffing levels, and will you commit to revising the guidance to include everything that was promised when the Act was debated?
It's exactly what it is. It's a consultation. I expect to have responses. I expect to have advice from our professional nursing officers here, including, of course, the Chief Nurse, on what is appropriate in terms of delivering patient care and meeting the objectives of the Act that this place has passed, and in delivering high-quality nursing care as we look to further develop the Nurse Staffing Act in other areas of practice across our NHS here in Wales.
Thank you, Cabinet Secretary. Safe staffing levels should apply to all settings as we move to a health service that aims to deliver more and more services in the community. We must ensure that community nursing teams do not have an excessive patient workload. The number of district nurses working in Wales has fallen by over 40% in recent years, but according to the RCN, their workload has increased tenfold. What plans does your government have to introduce safe staffing levels for community nurses, and what actions are you taking to increase the number of district nurses and reduce their workload?
Well, of course, we will be guided by evidence and the professional advice of the Chief Nursing Officer's Office, and that's actually something that the RCN support. They're very pleased that we haven't taken the approach across our border and effectively removing a Chief Nursing Officer from within the government to give professional advice to the relevant minister. And I've been absolutely clear with the RCN and other stakeholders that I'll be guided by the evidence and advice and the implementation of the Nurse Staffing Levels Act and taking an evidence-led approach to further expanding that reach across the service. So we're looking at different options about where would be the next appropriate place within the service to introduce and to reinforce the Act. But in terms of our ability to recruit more nurses in district nursing and beyond, of course, recently I announced a £95 million additional investment in nursing and other professionals for the NHS here in Wales. That should lead to another 3,000 training places across professions. That will include 30% more nurses after an extra 10% last year, 22% increase the year before that, and more than 4% increase in midwives in this year as well. So we are investing in our future, and I'm proud to have taken that decision to safeguard the future of our service here in Wales.